Good morning, everybody. This is Dana B. with Charlie M. and Kent G. from Mountain Patriots Educational Ministries. And today we have the opportunity of talking to Murray Jensen from On Call. And as you know, Mountain Patriots has been around now for the last 3 years, and we have several different ministries. And one of the ministries that we do, and we're very serious about, are children, and we're very serious about health, and those two really go in together. So with we wanted to make sure that we covered something that was easy, affordable, had access for the children and for people that are out there, especially with the way things are going on with COVID and people getting sick and so forth. So this morning we asked Murray to join us from OME, Ozark Mountain Entities, from Why Not OME. And I'm going to turn it over to Charlie to introduce our guest, Murray, who I've known for the last 7 years. We're going to have some fun today, folks. So pay attention. All yours, Charlie.
Thanks, Dana. Um, Murray, thank you for coming on and sharing us with us this new thing. It's new to us in the last year or so, um, and I guess you call it a virtual medical and mental health care service. Um, but before you tell us what that's all about, can you give us a little bit of background about yourself, where you came from?
Sure. Yeah, and thank you guys for allowing me to be part of this. I
Thanks for being here, Murray.
my background, I did several years in big corporate, and in the mid '80s, we some of the executives of the last company I was with, we started buying distressed and scratch starting companies, and have done that since the mid '80s. I came across this service actually when I was traveling the country. I spent almost every week somewhere in North America, and the one thing that I discovered is that if you needed medical attention and you were away from home, there was a challenge, number one, and secondly, it could be rather expensive. So it was introduced to me probably 13 years ago. Started using it. It was relatively new at the time, and uh, more or less did it passively. Um, Put together a group of people to help present. I call myself an educator. My job is to really let people know what is going on, and then provide some information as to why it's going on.
Mhm.
And then we believe we have a solution when it comes to what I am calling the medical and mental health care access and affordability crisis in America. And I put together a group contracted actually with multiple providers, but have found a company that I've contracted with that provides the back end, the platform, provides the doctor network. And so we provide virtual medical and mental access very affordably. So that's a brief background.
The
So,
Chief
so you kind
Education
of
Officer.
grew into this, right? I mean, it wasn't an aha moment that, oh, I gotta go do this, or was it?
No, it definitely wasn't an aha moment. For me personally, I had situations where, I live in Missouri. I'm in California. I'm in Florida. Don't feel well. I try to reach out to my primary care physician, and they want to see me, and obviously I have quite a distance, and in many cases we know what's wrong. We just need access to help and some solutions. So in some cases, that's a prescription. So as time went along, it kind of grew on me personally. Then I moved from being a user to my wife using it. And then she asked the question, well, couldn't our kids and grandkids benefit from it? And the answer was yes. So we purchased programs for them. And in some cases, 3 kids, 8 grandkids. There's been some cases where they've used it up to 20 times in a year.
Right.
And how much money and time it saved was pretty phenomenal. So then kind of my aha moment, if I've had one, came a couple of years ago, and had a partner of mine in my business. My son had a medical emergency, and we ended up in an ER room.
Right.
And I sit there with 300 of my closest friends, right?
In the emergency
And,
room. Oh,
Nothing
goodness.
is needed.
in the ER, and essentially standing room only.
Right.
There had been people in there. I mean, they were telling me there had been people in there waiting for up to 24 hours.
Hey,
And
Murray, real quick. That was a couple years ago,
yeah,
with it when right kind of right where we were in the COVID spot when you and I were doing a lot of work together.
yeah, it was it. I mean, it was kind of post
It was
COVID,
packed.
but you know what's happened. I mean, to finish that, what I discovered as I looked, out of 200 or 300 people, I didn't count them, but I noticed a lot of kids that would be my grandkids' age
Right.
were sitting in there, and do I know for sure? I don't, but in most of the cases, people have gone to using urgent care and ER as their path to
Right.
get medical treatment because they can't get into the primary care physician on a timely basis.
Right.
So if you have a kid that's sick, you want to get them treated. And unfortunately, ER is certainly not the place to do that. I mean, they will treat you, but it's very expensive. And so that's part of what I did when I realized that I could help so many of these people, that we kind of introduced a program that we're rolling with that's on call for kids.
Right.
And that is kind of opening some non-traditional paths, even outside of what typically is used to provide telemedicine or virtual care products as an employer-employee relationship. We've kind of broken that barrier, gone what the industry would consider to be non-traditional, so that individuals, associations, groups can participate and make this available. So hopefully that answers your
Just,
question, Charles.
just some um, truth in storytelling here. I have your service,
As
and
do I. Yeah.
what appealed to me when you mentioned emergency room was I have a primary care physician that I have. Fortunately, I'm able to get to pretty quick. But the part that was not covered was whenever I call after hours or weekends, they would say, go to the emergency room and if there's an emergency, or go to urgent care. So I really didn't have coverage after his office hours. And that's what your service just fits right into.
It does. Yeah. I tell people, ask me the question, do I need another doctor? And you should have a primary care physician.
Exactly.
And in all honesty, if you have a primary care physician and every time that you need it, you can afford it and you can get access, same day, next day, then that's what you should use. That
And that's what I did yesterday. My wife wasn't feeling well. I called for her on her behalf. She
Hmm.
was right next to me, and they did the intake, and the lady hung up. And less than a minute later, we got the call from the doctor,
Hmm.
and it was perfect.
I've had the same thing, Charlie. 17 minutes, I think, is the longest that I've waited. But we had a situation down in Myrtle Beach where I had a problem with my eye. I had a sty while we were down there. And this is back in 22. And how am I supposed to get a doctor? You know, I have insurance, okay, but you've got a huge deductible nowadays. So I sat on the sofa and I was with a friend of mine and Barbara, my wife, and I called, got a phone call back in 15 minutes, and they called in azithromycin for my eye while I'm in Myrtle Beach. We had everything done in less than an hour. Okay, no, I don't know where else you can do that, especially if you're out of town, and I can go anywhere with this. One of the most important things that we found out, though, is, and a lot of the Mountain Patriots have this program already, not just for mental health, but they have kids, and most of us will rough it out. I mean, we're guys. Okay, I don't feel good. I'm just going to take this. You know, my cure when I was younger was a few Budweisers and some Alka-Seltzer Plus, because if at least if it didn't work, I didn't care. you know, but you can't do that anymore. But you've got kids that really they don't have access. And Murray and I have worked together now for the last 7 years, and he and I got onto this whole thing. Not just, and we'll cover this in another spot because both of us we work with something called Saving Lost Kids for child trafficking and to stop that. But we wanted to be able to do something for the children. And Murray, we were talking earlier about Frederick County and so forth and the utilization in Frederick County. Am I correct? We were
But
looking at
yeah, I mean, we can, if you'll bear with me just a minute, yeah,
because
I
there's
can
about a
share
third of
screen.
the people out there that don't have any kind of care whatsoever. And if they do have care, they're spending through the nose. If they don't have care, then they're spending through the nose. And we all know that the bankruptcies, that's one of the greatest things for bankruptcy is medical, and people can't afford it right now. So this is a nice opportunity for people for about 70% of the things that happen to be able to handle that. So
So
what did you find out for us, Murray?
well, one of the things that, and it's applicable almost everywhere that I have discussions is that people are asking the question, why does it take me so long to schedule a doctor appointment?
4 or 5 weeks.
Why is so expensive?
Right.
Uh, I, you know, there's just so many questions as to why, and so I spent some time just kind of looking behind the curtain to try to figure out what happened. This whole process started before COVID.
Right.
I think COVID kind of exacerbated the situation, but on a national basis, I mean, we're spending $12,000 on healthcare. Now that includes health insurance and everything that we have, but 41%. Speaking to what you just mentioned, Dana,
Mhm.
41% of adults have medical debt of some
Huge.
kind, and 10% of people have more than spend more than $2,000 out of pocket annually. And so you equate that. $2,000 doesn't seem like a huge amount, but for somebody making $20 an hour,
That's big.
you would have to work 100 hours to make up that difference. So with with the pressure that disposable income, uh, I mean, there is a path for the price of a pizza or Netflix monthly
Right.
to be able to get access. Now we talk about health insurance, and we can come back to that, but health insurance, you should have it. One of the issues you have with health insurance is that it doesn't guarantee timely access
At all.
to be able to get it. So
At all.
so then we talk about, and I'll just to save some time, I'll hit some of the highlights. But
Hmm.
on a national basis, 28 million people have no insurance, health
Right.
insurance whatsoever. 43 million are underinsured. Now, what does that mean? That means, in the simplest terms, it means that your deductibles, your copays, your coinsurance,
Can't afford
your
it.
your out-of-pocket expenses annually are bigger than what you can truly afford. Hence, we have 41% with medical debt.
Hmm.
Okay.
And I've been in the insurance business, Murray, for the last 25 years with flexible spending accounts and HSAs and HRAs and every other way that people can try to mitigate some of that cost. And they still get stuck in that big circle that we're talking about right here. And people get sick and they run to the doctor. I'm not one of those people anymore that wants to, after COVID, learning what we've learned over COVID, but wants to run to the doctor for anything right about now.
Well, and we can talk more if we have time later, but there is a path. There's a solution. Culturally, we have drifted into the only way that we can get medical treatment is going brick or mortar.
Right.
So that's either to a doctor's office, to an urgent care, to an ER, and each one of those has their appropriate place um, that they're needed. But now there is a solution. It's just like we don't use corded phones, we don't use typewriters. I mean, the list goes on and on of the things where they've kind of run their course. I mean, Charlie just gave an example. We're kind of in an instant gratification society. And so the ability to even have the possibility, and 1 minute is pretty unusual, but to be able to have access to a licensed physician and the service that we have access to and we provide to those members that we have, they're available in all 50 states and Puerto Rico. We provide service in both English and Spanish,
Mhm.
and is pretty powerful. So on the mental health side, actually a couple of years ago, we kind of
This is
focused
big.
on we kind of focused on the medical side, but we had an opportunity to kind of bundle a behavioral health or mental health aspect into our
Right.
program, and you can see the statistics associated with those 57 million with mental illness, and um, quite frankly, people have a stigma against getting treatment or again affordability.
Hmm.
So provider shortages, there's a primary care physician shortage. These numbers vary tremendously, but we go beyond primary care. We get into support staff. We get into
Right.
nursing. I mean, the list goes on and on. But with then kind of going down to the last, is that 20% of our population will be over 65. So the demand on the medical system
It's huge.
continues to increase without an increase in the people that are there. Let me just say personally, I've had medical issues, and the people that I have been fortunate to have as my caregivers in the business are incredible.
Hmm.
But when you actually communicate with them, they all tell you that they're short staffed. So we can talk a little bit more about it. But let's dive into Winchester just a minute.
You
I
know,
mean,
Murray, I'm going to add something while you're diving into Winchester. You know, there was a time that I had a primary care physician for over 40 something years, same guy. Now you go and you get a physician's assistant. And the neat thing that I like about the on-call, the Patriots on-call platform, is I always talk to a doctor. Okay. And what's really neat, especially since you're bringing up Winchester, is I always seem to get the same two doctors. So over the last 4 years, they've gotten a chance to know who would remember somebody like me. Oh, I remember you. But I've gotten excellent care. But let's break down Winchester, because we're really concerned about being able to get care to the people that are here in Frederick County, Winchester, Warren County, and so
And this
forth
is not
around.
insurance, right? This is
That
a service.
this is not insurance, and we can
Correct.
talk about the difference. I mean, this is a mental and medical access plan that gives you access to doctors. Unlike health insurance, which is really a financial product
Right.
that spreads the cost and the risk over all of the holders, that this program, uh, you can have this program with or without insurance. This program's available as an individual, small groups. I mean, there's a lot of flexibility that we can put into making people have the ability to get treatment. And we can talk a little bit more about the specifics of that here shortly. The numbers just in the Winchester area, 8,200 people are uninsured, and another 23,000. So we're talking, 28% of the people in your community, according to these stats, are either uninsured or underinsured.
Absolutely.
And I mentioned earlier, kind of my passion now is providing access to medical treatment for kids. Obviously, for me to treat a kid, I have to have the family. One of the things that's unique about our program is that for one monthly membership fee, you can have access to the primary member, plus up to 7 additional household members can be on this plan, included in that same price.
You have 8 people that can
A
use
total
this
of 8.
program. Right.
So provider shortages, I mean, the information that came up for your area is about one primary care doctor for 1,800. I mean, there's a physician burnout rate, and I can tell you, I know many personally
Mine.
that they are burning out. Part of the reason that primary care physician shortage exists is that out of I guess out of the disciplines that medical students can come, family care, primary care, uh, seems to be the lowest compensated group of doctors. So if they're going to invest in medical school, they'll typically go into a specialty. But even on the specialty side, there's a shortage.
Right.
So and then we drop down. We drop down to the mental health surge. A lot of the activity that happens even in ER are mental health issues. And I mean, 18% of the population, according to this information, it is going to be over 65 in your geography, which again can provide a challenge for the system.
Right.
So
Kent and I
that's
had
kind of the
talked a lot
numbers.
about mental health. Murray, we work in our ministries. We work a lot with not just trafficking, but with education and so forth. And you've got young kids right now that we're fighting a lot with this. You go to a school and the schools want to put your kid on some kind of medication, and sometimes they just need to eat better or what have you. That's one of the things that we're working on right now, putting a kid on Ritalin or something like that. So that does create a serious mental health crisis. And we have quite a few members in our Mountain Patriot group that have this. We have one family that is very, very, very good friends with ours that used this program when their daughter was out of state, and they had to. I mean, this was a big deal, but to have somebody on the mental health side of this, um, on this on-call platform, was a lifesaver for them. And one of these days, I'd love to have them be able to tell that story. Kent, I know you're really concerned about what happens in the school with the kids and the health and everything else. You got a question here for Murray? I know you do.
Yeah, well, first of all, I want to say Hey, good morning, Murray.
Thank you. Good morning.
And I want to say I'm glad to see you're still here. I think I first got to meet you on Tuesday,
Yeah.
but every day for me is a Friday, so I don't even know what day it is half the time. I actually thought we were going to record this yesterday. I was like logging on. I was
Right.
like, man, what's going
Kent
on?
was ready.
Yeah. But I want to say you've weathered the storm of those nasty tornadoes, and glad you still got the roof over your head, which
Well,
is the most important
thanks.
thing.
I kind of live right at the edge of Tornado Alley, so it's just life.
That was crazy. What was it?
Yeah.
90-mile-an-hour
Well,
straight winds?
within 20 miles of it, officially was clocked at 91. So that
Wow.
it, still a lot of people without power. I eventually ended up losing my internet for about 12, 14 hours.
Wow.
But yes, thank you. We're still here. So
Good. Unfortunately for us, I think that low pressure is coming our way, but I think we're in the midst of getting rain for the next 4 or 5 days.
Well, it's Apple
Uh,
Blossom Festival. What do you expect?
yeah, and I'm not arguing against that. I think that's a great thing. But something that you mentioned when you uh, today when you first started talking, you started this application 12 years ago. Was it 12 years ago? You said.
yeah,
Um, I
well,
remember.
I got involved. Yeah, a little bit over 12 years ago is whenever I
Okay,
first got involved.
I remember. I want to say it was around 2013. I was in an outpost in Afghanistan, and I remember during when Biden was in, or not Biden, when Obama was in office, this was a push right around that time to go to the Obama healthcare plan, and
Obamacare, ACA.
yeah, and it was devastating because people like my wife's parents. They had to change their health care. It was horrible because just of the premiums and the deductions, everything was going up.
Oh yeah.
Uh,
I was in the
did you
middle of
get
that, Kent.
it was
It
horrible.
was
I mean,
horrible.
I was sitting there thinking like how are people, this is not affordable for people.
No.
I wanted to ask you, Marie, was that a catalyst for you to get started in this system that you're doing now?
Not directly, but indirectly. I think would be the best way to describe it. I, I as it to be honest with you, when it was first presented to me, I was one of those that believed that you needed to go to brick and mortar. If
Right.
you're going to get treated, that's what you needed to do. And as I got more exposed, I learned more. I learned about the challenges and the Affordable Care Act. There are some good pieces, quite frankly, in my opinion, that were in the Affordable Care Act that I think
Pre-existing conditions.
that the pre-existing conditions was something. As a small business owner, and I made decisions, and I had other investors, but as we made decisions that when we looked at health insurance, quite frankly, a lot of the decisions were made based off premium.
Right.
So the one thing that I learned through the years of being in a management team with a small business is that there's really not much you can do with health insurance premiums other than adjust copays, co-insurance, and deductibles. I mean, the higher you make those, the lower your premium on a comparative basis will be. And and then in a business situation, then as the premiums go up, you ask for more participation from your employee. But the one thing that happened, and they created the Affordable Care Exchange. Most people bought off of premium
Right.
price, right? And again, so you had different levels of program, and people would go with the lowest premium. Hence, they would have the highest deductibles, And in many cases, what ended up happening is people ended up with health insurance, but couldn't afford to use it.
Absolutely. And it's worse
So,
now.
so what ended up happening, which it kind of goes back to 30, 40 years ago, where your health insurance became a catastrophic plan.
Right.
And you got your value. So more specifically, Kent, to answer your question, as time went on and you could see the challenges that people were having, if you're making, if a family's making $30,000-$40,000 a year, or even $50,000 a year, and have $6,000 deductibles, and you've got one
You
or
don't have
two,
an insurance
three
plan.
kids or whatever else, you're going to be tempted to forego treatment if you think that you can make it through it. So you're going
Right.
to spend more time buying over-the-counter meds, which, in all honesty, in some cases, that is the right fit. But it so as it rolled out, was that a motivator for me? Not initially, but the longer that we go and we see what's happening in the industry, then it becomes more and more of a motivator. Yeah.
Absolutely.
Yeah, okay.
Absolutely. I watched the ACA. I was there when they passed it. That was March 23rd of 2010. I'll never forget it. We were like, all right, they're going to shoot it down. Oh no. Well, that changed everything for flexible spending accounts and the way we look at things and premiums and then the exchanges and then people couldn't get care. And it was just an absolute nightmare working with all of my brokers. But then I started, Murray and I were talking about this years ago, and I automatically saw the fit. When somebody had even a 2,500 or 3,000 or $5,000 deductible, I thought, well, if I can spend now back then, if I could spend $13 or $14 a month and I can get care without having to go to Baltimore, because that's where my doctor was, this made a lot of sense to me. And then I got a chance to use the program. And the first one or two times I got a chance to use this on-call program that Murray and I have been, especially Murray's been working on, it just saved us a fortune, Ken. I mean, one time. Okay. And what people don't realize is in the insurance industry today, a lot of these companies do have like a virtual care or a telemedicine part to it. Um, but you could be paying a copay, or that goes towards your deductible. And for the employer, it goes towards the utilization. So somewhere along the line, somebody's going to pay for it, and it makes your premiums or whatever go up. If we can separate those two, number one, I have instant access in like Charlie said, that's incredible, Charlie. A minute.
Yeah.
The last time I think it was 4 minutes for you. The
Yeah,
longest I think it's been about 25, 30 minutes for us. But I've got access. I don't have to leave the mountain except to go down to CVS and pick up a prescription. And
I think one of the other things that plays when we talk about the insurance side, and again,
this is huge.
You should, in my opinion, you should have a health insurance program, at least something from a catastrophic. But there's no question. But in today's world, then another big factor you play into is the network that your insurance is connected to.
Right.
And so in many cases, they're going to be connected to a local group of doctors. So if you travel much, I mean, you're on vacation, or you're traveling on business, many times your treatment is going to come. Now, on average, I would say that our program, in the virtual urgent care program, it has the capability of treating 65 to 70% of the reasons that you would need to go see a doctor. And many times, if you call them, they will tell you, this is what I think it is, but I think you need to go get checked out. So they will tell you.
That happened to me once. Yep.
A question that's often asked is, well, I mean, is this good medicine? Well, these guys that are in our network, this is what they do. Now, they may be connected to a hospital system, but they don't operate in our program with the rules of the hospital system. They may work. So what happens, just just so that people can know, I mean, there's a back end to our platform. When a doctor is available, I mean, his profile is stored in the back end.
Mm-hmm.
And let's say that he has availability from 12 to 1:30 today. And so he plugs in, he makes himself available. They look at his profile, and he's licensed to practice in Virginia, West Virginia, Maryland, whatever it is. So once he's logged in and available, and then there is a consultation request, then this person is connected to that doctor, and you will get treatment from a board certified licensed physician,
Not a PA.
in the state in which your feet are in. Now, there is a reason for that,
Mm-hmm.
and that is that they have to be licensed. If they write a script,
Right.
they have to be licensed to be able to send it to a local pharmacy. Now, people ask, will this program pay for the script? The answer is no. We do offer a prescription discount program, but for those that have health insurance, you would still use your health insurance prescription coverage, and it would be sent to your pharmacy. I mean, they will help coordinate. But when you first become a member, actually, when you think about it, if you go to urgent care, unless you go to urgent care in the hospital system, in the system in which you are getting treated otherwise,
Mm-hmm.
they really don't have much information on you. And so in this case, when you become a member, you set up yourself, you do your family history, you put in your medications, everything that's in there. So when you place a call, then the doctor can pull up your profile, review what's been done, can look at your history, and then he will use that as a basis to be able to answer or ask questions. They're going to follow the same protocol as what your doctor in a doctor's office are going to follow. There's a standard protocol. I mean, typically, hey, what caused you to come in today? What are your symptoms? What are your issues? I mean, they're going to go through those, and you're going to prescribe them to be able to do it. And I mean, it's good medicine. And are there other things that may be needed? Yes, and they're going to push you that way. I mean, they're suggest.
There's two things I want to add, Murray. Go ahead.
Let me just finish this. At least if you're going to go, a doctor has told you need to go, right?
Mm-hmm.
So at least there's some justification mentally that says, hey, this doctor says I need to get checked out.
Right.
So go ahead. I'm sorry.
Well, I was just thinking, because
All about the mission.
We've been on the road before, and somebody, I like the team behind it. When you call in, you kind of get triaged, and we've had situations, especially with the truckers that we were working with, Murray, where somebody's in Nebraska, they're from Minnesota, and they happen to be in Nebraska, and they're like, I'm driving a truck. Where do I get a prescription? And at on call, they're like, well, if you go down, I've already called it into a Walmart, which is about 3 miles away from you, and you can pull into that Walmart and park your truck and go in and get your prescription. I mean, that's pretty neat when you're on the road, okay, to get that kind of assistance from a provider, especially when you're on the road. And secondly, what I also liked about this, when I went to see my to get my physical this year, they always want to try to find something. Well, we want you to get checked, and then you end up in a system. So this person sends you to this person, who sends you to this person, and then get this checked out. And I'm like, there's nothing wrong with me. Okay. So I'm not in the cycle. I have somebody that is dedicated to looking at that specific situation that I have. And if I need a prescription, it's usually amoxicillin or Cipro or something like that. knocks it out in a day or so, and I'm right back on the schedule. But I'm not in that system. I'm not in that get rich, referral system. And I know you've all experienced it. You go into the doctor's office and they'd say, "Oh, well, I see something in your eye. You might have glaucoma or something. You might want to go get that checked out. And here's a referral for you to go see my buddy down the street." See, that eliminates that. But I also, to go back to it, love the fact that if I'm on the road, somebody will tell me exactly where the pharmacy is and give me exact directions on how to get there. That was really cool.
Well, there is a team. So to
It's a
gain
team.
access, to gain access to a consultation, there is a smartphone app. I mean, it ties to your portal. I mean, you can request a consultation on your app, answer
Click.
questions. It'll ask you what state are you in. It'll describe. It'll look at your medications. It'll look like it will give an opportunity to share any medications you may be allergic to. Basically, it's the clipboard in the doctor's office and the electronic medical record.
And it's always
I mean,
there.
and it's available to the doctor and to you to keep up. So as you become a member, then you get an opportunity to update your electronic medical record. If you have a spouse or significant other that's 18 or older, then because of HIPAA regulations, because our service complies with any security issues associated with HIPAA, then that person needs to manage their own back end, so to speak, so their own electronic medical record. But if you have kids under 18, then you can complete that. You can be on the call with them.
Right.
And my grandkids, as an example, if there's an issue, I kind of all my grandkids have been involved with travel sports at times. I mean, there would be times where they would be 200, 300, 400 miles away, have an issue. They make a phone call in the car while they're driving. They do a consultation, and then they either, if a script is provided, then they coordinate to see if it can be picked up along the route as the trucker did, or it can be sent into your pharmacy back home. And that happened on multiple occasions. So there's a lot more flexibility than what brick and mortar can provide. And so a business owner, the list goes on and on. So the primary treatment, I pulled this up. I think you can see this. It talks about the program, but I mean, it's a monthly membership program. The common conditions are listed on there, but for most of us, we've had something similar in the past. We just need help if there's a medication in the form of a prescription that could help. One of the questions asked, well, what's going to happen is you're going to be over prescribed to antibiotics. I mean, that still is a big concern. And statistically, what's been discovered is that you're probably less likely to with virtual care than what you are with urgent care. It's not a lot different, but personally, I know I had an issue. I called 3 weeks ago. I didn't get a response as fast as Charlie's, but I placed a consultation request. 19 minutes later, I got a call back. Within an hour, my consultation was done, and I had my medication in hand. And my condition was viral, so it wasn't antibiotic, but they recommended a medication or two actually for me to use. And they called those into the pharmacy. The pharmacy actually pulled it off the counter, had them waiting for me, and I took care of payment, and that was done.
I love it.
So I mean, there is a lot of flexibility with that. So
Dana, you're going to say something about Rick?
Yes, I do. As you all know, folks, Barry, first off, this has been great. Mountain Patriots is an educational ministry, and there's two things I'd like to cover. One of our members has what is called, and Barbara will put it up there, it's called Southern Light. And it's, if you're in Frederick County or around here, Winchester, it's 104.9 and 90.1 FM. It is playing classic Southern gospel music. And this station was just taken over by a good friend of ours. The person that had it got sick, and we didn't want people in the valley to not have the good Christian gospel music that these stations provide. But this station could use some help. So it works by donation only. It's a 501c3. And if you'd like to donate, please send a donation out to P.O. Box 35 in Gore, Virginia. And I'll grab that address for us real quick. It's P.O. Box 36, Gore, Virginia, 22637. We want to make sure that we keep the good Christian stuff that's happening right here in the Valley. So that is Southern Light, 104.9 and 90.1 FM. If you all are listening to us, you all know our buddy Rick. He's spending a lot of time making sure that you guys have great music. He runs 6 radio stations, keeps them on the air. And we want to make sure that these stations stay up and running. So any kind of contribution or donation would be great. That's our first announcement. And second is Mountain Patriots is doing the Health and Freedom Conference on June 28th of this summer at the Millwood Fire Hall. It's based on civics. Since we are a ministry and we're covering, one of our ministries is to make sure that we cover the Constitution, we're going to have people there that are actually teaching us what their positions are. Most people don't understand when they vote for anybody what the actual person they're voting for actually does. So we have delegates that'll be out there explaining what they do. We'll have our senator out there explaining what he does. We have our attorney out there. We have our 6th district chair explaining what they do as far as elections and keeping everything rolling. But we also have some great speakers on education. Ann Kraft-Tatus will be there for Virginia for Children's First, Virginia Medical Freedom Alliance, which is Dr. Sheila Fury, on what's going on. A lot of this has to do with the medication and mental health. She's a psychiatrist for children, so we want to make sure we take care of the children. We have the Liberty Man, who's going to be there talking about the Constitution. We have George Washington, who's sitting with us here today. He'll be in full gear. He's coming back from the 1700s to join us. And we also have good friends of us, Chris and Debbie Cloud, explaining what's going on as far as world events and national events. So make sure that you get tickets at wakeupwinchester.com. That's wakeupwinchester.com. And we also have a sweepstakes for his and hers raffle for a 2A raffle, a 2A sweepstakes. So make sure you go to wakeupwinchester.com for that. So without taking any more time, make sure you give to Southern Light, check out our site, and we'll turn it back over to Murray to finish us up here on how people should. What's the best way, Murray, literally for people to be able to gauge in this? I know they can come through us. You know, I have a site and so forth. You have your site. You and I have worked together forever. What's the best way for people to be able to do all of this?
Great question, and thanks for the opportunity.
I think everybody should have it. Half of our Mountain Patriots have it now. And I wish we had a few of them on here to do some testimonials for you, because they'll all tell you how it works.
Let me take a step back to answer that, if you'd allow me, and
Sure.
and then we'll kind of move forward. I can tell you personally, and people will say, "Well, yeah, you're involved with it," but I will never be without this. My kids and grandkids will never be without this. For the most part, virtual care has only been available through an employee-employer relationship, and quite frankly, that's great. I mean, we're in excess of with the group that I work most closely with now, we're in excess of 6 million members nationally. That there are, I don't know what the number is for sure, but there are millions of people using other platforms. I think we create a uniqueness. So we're one of the few that can affordably offer a program for, quite frankly, less than what the average cost of an urgent care visit is per year. We can offer a program on a monthly basis to be able to get access. So the ability to get a return on your investment compared to a pizza or a Netflix membership,
Right.
It is pretty powerful. So yes, you can do that individually, but we also offer programs to work with employers. So if you see this, you have an employer, you think that it would fit with your team, then you can communicate with them, get back to Dana. We can explain how the program benefits them and your team. If you're in the service industries, I mean, the list goes on and on. So there is a path. Individually, that there, and I'll pull up a page.
Murray, literally, we fought for this, and you were able to work it out. So we're one of the few out there that can actually do something individually. This was originally for businesses. You don't want, if you're a car dealer and you have your bays open because somebody is sick, you're not making any money, and neither is the person that works there. So you want to be able to keep that person on the job and the bay open so that people are earning money. But we also wanted to be able to offer this to individuals as well, because for the most part you can't get it, and if people do have something like this and it's hooked to their insurance, or they have another telemedicine or something like that, only the utilization for that, Murray, is what, usually less than 5% of
Yeah,
people actually utilizing it because they don't know how it works.
I mean, statistically, obviously not everybody reports this, but
Right.
I mean, the program as it's included with a health insurance product typically does not get the utilization. Now what that means is that the number of times that the number of consultations that occur in a year. So for every 100 people, it went up after COVID because it became a little bit more normal.
Couldn't leave the house.
There was a lot of resistance earlier, and that resistance just we've developed a culture to be able to go to a brick and mortar, and there's an appropriate place for that, but there's an appropriate place for this. So what we've done, and I'll kind of show you where this is. If you do a screen, if you take a picture of this QR code, it will take you to a page that will describe the service. And this is for an individual now, but if you go to that page, it'll take you to virtual urgent care, on-call-info virtual urgent care. There is a place to order it. The normal retail price is $17.95 a month. And if you annualize that, that's less than $200 a year, which in most cases is less than what one visit to urgent care would be in your area.
$1,500 to go to the emergency room, Murray.
So if you use podcast 2 as a coupon code, then that will actually save you $2 a month. Now, I'm going to, I'll pull up the page that you would actually go to when you get there.
You have no idea how much I appreciate you taking the time to do this today, Murray, because this will save people an absolute fortune, especially with what we've seen in the last the last year and a half.
Or you can go direct by typing in that URL that's in there, but it'll take you to this page, and it'll give you a description. There's also an FAQ section with questions that you may have. Obviously, if you have more specific questions, you can reach out to Dana or me to be able to do it. But it describes the program. You would just click. I mean, it's a membership,
Right.
so you become a member of this group, and you would type it in. It will take you through the process, and as the primary member, um, you could you just go ahead and click join. Again, it's just you can use, in this case,
Podcast too.
and you can apply the coupon.
I appreciate you putting this discount in for all of our people, Murray.
Anyway, so it brings it down to $15.95. Again, considerably less than one visit. And then you would just go through and proceed to check out. We do ask for birth date because we have to make sure that the primary member is at least 18. There's some other information that it's going to ask for, but there's no pre-existing conditions. You can't be excluded. You don't have to answer a bunch of questions. Whether or not you're being treated for something else, we can't be denied. I mean, you're guaranteed to be able to have guaranteed access to medical and care. The mental health side, I mean, you'll be enrolled in that at the same time. If you have some crisis management, you're having behavioral problems with kids, whatever else, then you call the member service team and they'll set you up to talk to a master degree counselor.
That's huge.
To deal with any issues that may be. And we just recently added the availability to get virtual consultations for a charge. Now, the behavioral health counselor is a $0 consultation charge. Also, the master degree counselor, if they believe or you need to talk to a psychologist or psychiatrist, that there is a charge for that. I believe it's $100 per consultation. I think the market finds, but you can do all of that virtually. But that's how you get going, and then. So you would go through the process. I mean, credit card, but it's gonna. I mean, basically, here's the questions that it's going to ask: is street, phone number. We do need an email address. That's how we communicate. Once you complete the payment and it accepts the payment, then you're going to get. Within 24 hours, normally you're going to get an email from our vendor, My Telemedicine Lyric, and you'll have an opportunity to be able to activate your membership. And
Minutes.
again, you can get a consultation. You can use the app. You can use your computer. You can use the phone called member service. But as Charlie described, Charlie, I appreciate you sharing that. There may be an expectation that if it takes 3 minutes, people are going to get off.
Yeah.
But
you do say
anyway,
it takes 45 minutes or so, right? What is the time period for expectations?
Less than 2 hours.
Our intent or our group's intent is that you're going to get a call back within 2 hours. Guaranteed. So if with many of the telemedicine services, virtual provider, many of them are hospital based. That's great, but most of those are set up to utilize the same people that you may not be able to get access to anyway. This is entirely separate from anything associated with your insurance or your preferred local medical provider. Right. And so that's kind of the process. Again, this is for individuals. If there's anybody that's if you use the podcast too, that $17.95 goes to $15.95, which is again less than one urgent care visit. If you're an employer, then basically it's a one-page application, and we can set it up to where you pay it for your employees, or you do it on a voluntary basis, do a payroll deduction, or if you don't want to mess with any of that, then you can work with us and we can actually set it up to where your employee has access at a discounted price. And they take care of it individually. So we have some flexibility.
Then
And
we
we can
want to.
also make a donation for anybody that does this. We can take a little bit and do a donation, which is what we're working on right now, that goes back to the ministry to be able to help other people out. So this isn't a big moneymaker. This is a more of a community service to make sure that we're taking care of people that are in the community.
Guys, I didn't get a page put up to show this, but in the United States, there's 20 million kids and their associated families do not have real access to medical and mental health care. 20 million. In your area, I believe the stats is there's close to 10,000 kids that fall in that category. And my mission is I do not want a kid with a sinus infection, earache, whatever else that we can treat affordably. I want to find some path that we can connect them to a service where they can get treated and not suffer because they can't afford to go.
And this is that service. It's very obvious to me.
This works. So, I mean, to be honest with you, non-traditional. Virtual care is becoming traditional now. There's a lot of choices, but from a non-traditional standpoint, we're talking to churches to be able to offer it. We actually have apartment complexes. We're offering it to their tenants, and there is an ROI associated with that because, if you can divert unnecessary spend that goes to ER or urgent care that can be treated by us, then that's money that can help them and help their tenants make rent payment next month, have more disposable income. Associations, organizations. That we have a lot of flexibility.
Chambers
that is not driven by an employer-employee relationship. So
excellent.
There's a lot we can do.
We're coming up to a hard stop.
Yep. Kent, do you have any final question?
Not really. I was just actually taking a look at your webpage right now. It's
Of
put
course
together
you are. I know, Kent.
it's put together very well. I'm looking at the facts, general questions, a lot of stuff that could be answered. Just take a look at these things for a very basic overview. And that's it, Murray. I hope to talk to you later in the future. It was good meeting you the other day, and hats off for you for doing this. I think this is great.
I appreciate it.
Well, if I could just share one testimony, and then I'll bail out if you're done with me. But let me pull it up here. Whoop, wrong button.
I think I know where you're going with this.
A couple years back.
Elizabeth.
I work with people. I'm in Missouri. These guys are in Virginia area. I've got clients across the country, but I actually apologize for the technical difficulty here. It's amazing what happens when you push the right button.
Exactly. Is this your New York lady, Murray?
Yeah, there is a long story, but sometimes as you work with something, there's always a question that comes to your mind. Are you really? Is this the right thing to do? Right? And so there's a long story behind this. I'm not going to share all of that today if I can pull it up, but there was some interaction that happened. This was an individual. This was an individual purchase of a program, but you can see the one on top. and she purchased the membership on a Friday morning, actually during the middle of the night. And
We're in the middle of the
a
night.
couple conversations. I mean, she's told me I could share anything and everything, but I don't want to take the time now. But through the course of Friday, Saturday, communication on Saturday, and then I got a text, and this is just the beginning of it. I mean, she goes into much more detail, but I get this text a little bit after 10 o'clock on Sunday evening, and it states, "Your service saved my daughter's life." And as soon as the physician heard my daughter speak, he told her to get to ER immediately. We went. She was having an allergic reaction to her antibiotic that she had received from an urgent care,
Mhm.
and her throat was swelling, blocking her airway. They rushed her in, and she's been in ICU since last night. Her condition has improved tremendously. I thank you for that voice over the phone that told me we needed help. I will forever be grateful to your service and the doctor on the other end of the line. So
That was
why
a
do
big
I
deal.
do why do I do what I do? It's comments like that. Now, the only thing that we were able to help with was to give direction to get to ER. But if you're in a situation that you may have financial constraints, issues, all of a sudden saving your life, then dollars don't become quite as important. You'll figure that out afterwards, right? And so in this case, the fact that a virtual doctor was able to do that, there is power in being able to have access at no cost other than a monthly membership fee to be able to talk to the doctor. I would welcome an opportunity to talk to anybody and everybody that's listening, to be able to work out something that their employees, their family can have this access. So
Yeah.
again, thank you for the opportunity to be on board. I appreciate you all so much. And I
Thank
think
you.
that's all I have.
We love you, Murray. But Murray and I go back 7 years, spent a lot of time, and we've seen a lot of different things happen, especially medically, going all through COVID and everything else. But I want to sincerely thank both Kent and Charlie. Is we're the three. We call ourselves kind of the three, like you see on TV, the five, and we get a chance to, the three of us get a chance to do this and figure out what topics we want to cover. And Murray, this was really important to us, um, in our health ministry, especially, and with the children's ministry, making sure that the children are safe and taken care of. So, real quick, lastly, I just want to remind everybody to hit Southern Light. Okay, Barbara, we'll put this in the description in the description box at the end of the video. If you can make a contribution to the radio station to keep our Christian radio station on board, that's PO Box 36 in Gore, Virginia, 22637. We want to make sure we have good gospel music there. Also, we have our Wake Up Winchester on June 28th. That's our civics class and a lot of fun with George Washington. Right, George?
Right.
All right, George will be there. And you'll be able to get tickets right at wakeupwinchester.com. We also have the sweepstakes for the 2A giveaway. And with that, I'm going to turn it back over to Charlie. We have what's called the Patriot Prayer, which seems to be really taking off, especially here in Frederick County. Murray, I want to thank you, my friend, for being here today. And I'm going to ask Charlie to take us out with a prayer. Can you do that, please?
Thank you, Dana.
Thank you, Charlie.
Dear Lord, thank you for this beautiful world and the country that you've given us, and the patriots who are willing to care for it. Thank you for inspiring our founders to create this beautiful republic. Please help us to keep it as the aspiring place to live. Please give us the wisdom to do the right things, the common sense to judge wisely, and the energy to never give up, and your unending grace in which we take comfort. In your name we pray. Amen.
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 Everybody, thank you so much. That is a
Thanks again.
wrap. That is a wrap. This will go out over and over and over and over. This isn't one of your standard, Mountain Patriots Educational Ministries podcasts. This will be able to go out there over and over and over until there's enough people that get the opportunity to see this. Murray, thank you very much.
Thanks
Guys,
again
as
for the
always, it's been a
opportunity.
pleasure. Have a very blessed day. Murray, happy birthday.
No, thanks.
Take care, guys.